The multimodal approach to pain relief sounds like a good idea, but has there been any research into how well it works in practice?
Blumenthal has published a nice review article in 2019 where he looked at a historical pre-ERAS cohort and then in post-ERAS introduction cohort for four different types of surgery, that being colorectal surgery, but then also GYN OB surgery. And he has shown that you could actually reduce postoperative morphine equivalent requirements dramatically by as much as 80%. 80% reduction in opioids, that's huge in the postoperative period, without compromising patients' well-being or complications.
That's very interesting. Now, you mentioned non-opioid analgesics. So in practice, that's going to be paracetamol and non-steroidal anti-inflammatories. And my question is, what is the value of intravenous administration of these? Surely these drugs are well absorbed anyway.
Yes, they are well absorbed. However, you have to remember that most of the pharmacokinetic studies that we're looking at are in healthy volunteers, right? So those are patients that did not have, or those are volunteers, obviously, so they didn't have any surgery, and they didn't get any opioids that might slow down GI motility. So we don't really know how much of these drugs are being absorbed. And if it really comes down to timing of onset of action, I mean, what are we doing? We're going to go for IV, right? That's what we do in the peri-operative period all the time. So if you want to time the onset of action of your non-opioid IV analgesics, you need to give them intravenously.
That makes perfect sense. So actually, it's all about the timing of onset of action. So are the benefits of intravenous paracetamol and non-steroidal anti-inflammatories supported by research?
There is research that has shown that with, well, slightly better pain control, that actually did not reach a significance in most studies. However, we get those slightly better pain control with a significantly reduced opioid requirement. And that is usually or very often accompanied by reduction in side effects that are typically caused by opioids, such as nausea and vomiting.
That's really good from a patient's perspective.